Syphilis can seem like no big deal at first, a sore that disappears on its own. But untreated, it can hide for decades and eventually eat away at your brain. Syphilis isn't just old school. It's back, and it's dangerous. It's the STI that goes from a painless sore to full-on brain damage if you ignore it long enough. Sounds extreme? That's because it is. Let's break this down. Syphilis is caused by a bacteria called Treponema pallidum. It spreads mainly through sexual contact, and in some cases, from mother to baby during pregnancy. Now, it doesn't come out swinging. In the primary stage, it shows up as a small, painless sore called a chancre, usually on the genitals, mouth, or rectum. It heals on its own, which makes people think the problem's gone. It's not. The bacteria is still in the body. Then comes secondary syphilis. Think rash, sometimes on your palms or soles, fever, sore throat, hair loss, swollen lymph nodes. Again, these go away. Again, people think it's fine. Again, it's not. If you're unlucky or just unaware, syphilis enters a latent stage. No symptoms, nothing at all. But the bacteria is doing work behind the scenes. Years, sometimes decades later, it can rear its head as tertiary syphilis. And that's when things get seriously grim. Tertiary syphilis means your body's under attack. The bacteria starts damaging major organs, your heart, blood vessels, nerves, and most dramatically, your brain. This is where the phrase Swiss cheese brain comes in. When syphilis hits your brain, it can cause neurosyphilis. That's brain infection. Real holes in brain tissue. We're talking memory loss, personality changes, tremors, even full-on dementia. People can lose their ability to speak, walk, or recognize loved ones. And if you let it get to that point, the damage can't be reversed. So how does this happen? The syphilis bacteria attack the blood vessels in your brain, cutting off oxygen. That leads to tissue death. Hence the holes you see on scans. It's not just a figure of speech. The worst part? This is all preventable. A simple antibiotic, usually penicillin, can wipe out syphilis in the early stages. One injection, done. But if you don't catch it early, that one shot isn't enough. And the damage from neurosyphilis, it's permanent. So what can you do? Start with regular STI testing, especially if you've got new partners or multiple partners. Use condoms. They help, although syphilis can show up in areas condoms don't cover. And don't ignore the signs. A weird sore, an unexplained rash, anything off. Get checked. Fast. Also, if you're pregnant or planning to be, make sure you get tested. Congenital syphilis, passed from mother to baby, is on the rise. It can cause miscarriage, stillbirth, or serious birth defects. Let's be real, syphilis might be old, but it's not gone. Rates are climbing again, and not just in one group. It's showing up in straight and queer communities, young people, older adults, even in newborns. So if you think it's something that only happens to other people, think again. Sexual health isn't about shame, it's about staying informed and taking action. A quick test, a fast treatment, and your brain stays hole-free. Thanks for tuning into MedHeads. For more health tips and conversations that matter, make sure to subscribe and stay informed. We'll be back with our next episode, diving deep into everything health-related. Until then, take care and stay healthy.